On the other hand, you can treat your arthritis without surgery, and that's the different pathway. And in that pathway, we look at your knee as a math problem. And the math problem is pretty simple. It says that every day you make cartilage cells, and every day you lose cartilage cells. And what has happened over time is that you have just lost more than what you made. And the net result is now that you have some pain and inflammation to your knee. But that pain and inflammation to your knee is just not the loss of cartilage, but it's also a biochemical change that's in your knee, where there are certain chemicals in your knee that start to rise in their concentration that cause pain and inflammation. And those biochemical markers can cause further pain and destruction to your knee, even though it's trying to repair itself. So that has to be addressed too. And so when we look at your knee to try to treat this without surgery, we look at the things that are causing the destruction and what can we do to eliminate those. And then we look at the things that that help with the reparative process and how can we add those into your treatment plan. So key things which may seem that it isn't important, but actually goal setting. Patients who set goals for themselves do much better than patients that don't. This is also proven in business and also other venues, even education. So we do have you go through a goal setting exercise. We talk about real simple things like weight control, because just 1 extra pound will mean an extra 4 million pounds across your knee each year, so it's a huge payoff. If you just lose as little as 10 or 11 pounds, you can significantly reduce your risk for a knee replacement. We talk about good exercise and doing those, such as anything in the water, ellipticals, and just normal walking. And then avoiding things that can actually cause damage to your joints, like stop and go sports and any pounding activities such as running or aerobic exercise. We also talk about shoe wear, because every time you take a step, there's a thing called a joint reactive force that comes back up through your joint and can cause pain. We can reduce the speed of that pain or the velocity of that force that goes up and through your joint by just proper shoe wear, and that we can actually reduce that by almost 3,000% compared to high heels. That's simple with simple shoe wedges that we can use, and we'll go over 3 steps that can show you what's a good shoe and what's a bad shoe. We also talk about nutritional status, and there's certain things in your diet that can help. It's not going to cure your knee, but it may make it feel better, and the same thing with some nutritional supplements. Again, there is some evidence, although it's not real strong, for things like vitamins A, C, E, and D that may have some benefit, as well as some glucosamine sulfate. And the sulfate's important because the sulfate form is really the only one that works. We also talk about bracing that can help stabilize your knee and help correct some of that angle that you have in your knee. And then we also talk about you having a frequent follow-up with this, so we can help coach you through this whole process. But as far as other things that you can do to actually stimulate more repair, there's certain things like hyaluronic acid, which is trade names like Suparts or Hyaluronic, that replace something that you're lacking in your knee. You normally have this substance in your knee called hyaluronic acid. Actually, you have hyaluronic acid anywhere where you have collagen, so eyes, your skin, that is filled with hyaluronic acid. As you age, that starts to break down. That's also found in your joint and the joint fluid too, and the joint fluid starts to break down and it gets thin. And so we can replace that, and think about it almost like an oil change to your knee, and that can give you some pain relief. But only about 60% of patients will respond to those treatments, and it's a series of either 3 or 5 injections given 1 week apart, and it may last up to a year, and it can be repeated.